this is Dr. Wheeler and my assistant Penny. I'm here to give an informational section about cleft palate and how it affects families and children affected with cleft palate. Cleft palate is an opening or split in the roof of the mouth that occurs when the tissues of the face don't form together. It is one of the most common birth conditions that occur in children. It affects hearing, speech, and feeding. With feeding being one of the most important issues that families need to look into. Hearing effects are also very important. The family, thank you, assistant. The family will need to have a very good relationship with their audiologists to make sure hearing is consistently assessed. Breathing is also affected by cleft. And so cleft can occur unilaterally or bilaterally. It can affect the hard palate, the soft palate, the lip, or it can affect a combination of all. It is the second most common congenital birth defect in the United States. 1 in every 940 births a year are affected. Children are affected with this. Cleft is a non-progressive disorder. Clefting only happens prenatally and will not worsen over the course of the, individual, thank you, Penny, individual's lifetime. There are psychosocial effects of clefting. Families need to be, aware that their children will have lower self-esteem with any type of facial anomaly, and they should seek out proper treatment or services for this. The family will also have to undergo extensive surgery and medical care, and so this can also be stressful for the family. And now we will go into causes.
Oh, Dr. Wheeler here again, enjoying a non-alcoholic drink. So I am here to talk to you about causes. And so I know that being a parent with a baby with cleft lip or palate must be overwhelming, and you must feel responsible. But let me tell you, that's not the case. Please don't feel this way. We actually don't understand the cause of cleft lip or palate. It's really, what's the word I'm looking for?
Combination.
Thank you. It's really a combination of environmental and genetic factors. So, what are some of the environmental factors that could affect cleft lip or palate? Well, we have smoking, drinking, measles, viruses and chemicals during pregnancy. There could be a family history, which that is not environmental. And there could be medications that you take that can cause a cleft palate, like acne medications, antidepressants, maybe if you overdose on aspirin. If you have tumors in your uterus, it makes it crowded, so it affects the development of the baby. If you have multiple pregnancies, just because, again, the space. If you have diabetes, if gestational diabetes can possibly affect it, obesity, and also vitamin deficiencies such as vitamin B and folic acid. Now, again, these risk factors do not guarantee that your baby will have cleft lip or palate. Really, it's just kind of the things that we've seen that possibly can trigger it, but it's still not a definite answer to that. Just because you had a drink of alcohol during pregnancy does not guarantee to ask the cause of your baby's cleft. Remember that most of the time, this cleft palate occurs 12 weeks within the first 12 weeks. And so at this point, you don't even know you're pregnant. So really just kind of a really quick overview of how cleft lip and palate is affected, is caused is if there's a disruption in development when the lips are coming together, you have a cleft of the lip. If there's a disruption when the palate is coming together during development, then you have a cleft of the palate. So I hope that helps you understand. Ta-ta!
Hi again, Dr. Wheeler here. I'm going to be talking to you today about assessment for your cleft-affected baby. So your baby has a cleft, and there will be a team of people helping you, your baby, and your family help adjust to the needs of your new child. A very important step in this process is a comprehensive screening and assessment of your baby to determine the unique characteristics and needs associated with your baby's cleft. There will be a team of people involved in this assessment process. Your assessment team will include people such as your speech-language pathologist, your otolaryngologist, plastic surgeon and oral surgeon, your pediatric dentist and orthodontist, your audiologist, and other doctors such as a geneticist, a pediatrician, a nutritionist, and maybe a psychologist and social worker. Your speech pathologist is very important when it comes to the assessment of your baby. They will do multiple different types of assessments, including physical assessment, a feeding assessment, and a vocal assessment. The physical assessment will involve looking for any structural differences in your baby's mouth and face, look for the size and specific location of your baby's cleft, feel the muscle tone of your baby's face, lips, and tongue, check for age-appropriate feeding responses, and watch you as you feed your baby. The feeding assessment will involve things like how long does it take to feed your baby? How much milk does your baby take when he or she feeds? How often does your baby eat? During the vocal assessment, the speech-language pathologist will measure your baby's vocal complexity, and this involves looking at different kinds of sounds your baby is producing. They will also look at how fast or slow your baby is producing these sounds, as well as what kind of gestures is your baby using to communicate. Thank you.
Oh, hi. Dr. Bilo here. I'm here to talk to you about treatments. So, whether or not your baby is cleft affected, learning how to feed can be difficult for all parents. We'll go over the basic overview as it's different for individuals that are cleft affected. Some pre-surgical or non-surgical options can be taping, when you could tape the cleft lip or palate closer together. Latham, which is like braces for your cleft palate, and you would need to visit your orthodontist and tighten that up weekly. Something else we could do is nasoalveolar molding device, or NAM for short. This is like retainers for your palate. It just kind of closes up the palate so your baby can feed and create that suction. Surgical repairs for cleft lip would include incomplete cleft repair, which can take between 3 to 5 months of age. Begin 3 to 5 months of age. Complete cleft repair of all structures that are affected, which can be done between 5 to 6 months of age. And lip nasal adhesion, which is the first step towards full closure of the cleft lip. After lip repair surgery, it's normal for your baby to be swollen for a few days and the scar to be red for weeks. Given time, the scar will soften and fade within 6 to 12 months. Surgical repair for cleft palate will include your craniofacial or plastic surgeon, and it will close between 8 to 11 months and just in time for the first words. So let's go with your team, because your team will be a vital part of treatment. The two vital roles in your team will be your SLP and your audiologist. Your SLP will work on your child's language development milestones if your child progressing at a typical rate. Supervise interaction between you and your baby, because your baby's first primary care physician or caregiver is you. Promoting proper speech habits, increasing awareness of airflow, and forgiveness, because not only is it good to forgive your child, but also for yourself. The audiologist is vital in assessing and managing potential hearing loss, so that weekly visits or even yearly visits are necessary. Other professions involved is the cranial surgeon, facial surgeon, orthodontist, pediatrician, geneticist, nutritionist, social workers, and psychologists. That's it for me.
Honey, is my dinner ready?
Be right there, darling.
Hello, I'm Dr. Vila, but I've since gotten married to my husband Dick Pharyngeal Flap, so now my name is Dr. Velopharyngeal Flap, and I'm here to talk to you about family support for your cleft-affected infant. So first of all, don't be scared or intimidated. Your baby is born with the innate ability to suck and swallow, so they are ready to eat. Being cleft-affected definitely impacts feeding practices, but there are options and supportive care to help you through the process as your baby ages and through his subsequent surgeries. The primary goal of feeding your infant is, of course, nourishment, but it also provides a nice opportunity for mother and baby to bond, or whoever's feeding your baby. Some feeding tips are, keep a regular feeding schedule of every 3 to 4 hours for 20 to 30 minutes. Your baby will be taking in more air than a non-cleft affected baby, so you will need to burp him or her more frequently, every 5 to 6 minutes. Hold your baby at a 45 to 60 degree angle to help the flow of formula from going back into the nasal cavity. And also tilt the bottle to keep the nipple full of milk or formula, but make sure it's tilted away from the cleft. During and after feeding, keep your baby upright for 30 minutes to reduce the chances of spit up or nasal regurgitation. But if that happens, don't worry. The nose will clear itself when your baby sneezes or coughs. Now, Mom, make sure that if your milk has not come in yet, you should see a lactation specialist, because there may be a problem that has nothing to do with how your baby is feeding. And a hot tip, keep a record of your baby's weight every 4 to 6 weeks after birth. They should be gaining around 2 pounds per week, but check with your primary care physician. There are many suggested bottle and nipple options for your baby. The Medela Special Needs Bottle, the Mead Johnson Cleft Palate Nurser, the Pigeon Nipple and Cleft Palate Bottle by Respironics, Dr. Brown's Specialty Feeding System, and the Nuck Orthodontic Nipple. You can also use any of those in combination if those work better for your baby, or you can alter a standard nipple or bottle by either cutting off the bottom of the bottle so you can squeeze and help your baby feed, or you can cut an X in a normal nipple, which will help your cleft baby feed as well. Feeding after surgery, they should be able to keep about the same feeding schedule, and you can just pick back up with a bottle. And once they're ready to start eating solid food, don't use a bottle. Definitely use a spoon. Great, do that. But most importantly, remember, you and your baby are in this together. And this is not your fault. Thank you.
Thanks, Dr. Velopharyngeal Flap.